So we are very pleased to announce our community opioid strategy, and it took us some time to develop this strategy. We work closely with our community partners to come up with some of these recommendations that we think would be useful for our community. We use the 4 pillars approach to address the issue, and the 4 pillars are obviously the first one is the prevention and education piece, where we are focused more on how we can prevent for someone from using the opioid in the first place, and what kind of education that we need either in our healthcare providers, the community, the parents, and even starting from children in school. What do we need to do? And then the second pillar is the harm reduction piece, and so that pillar focuses on the assumption that people who are already using opioids, what is needed to prevent some of the harm that comes after the use of opioids, and that includes some of the harm reduction supplies. We talk about needle exchange program, we talk about supervised injection sites, we talk about working with those individuals, reducing those stigma. And the third pillar focuses on the treatment and rehabilitation piece, and so that specific pillar focus on the individuals who require treatment, and what are the treatment options, and how we can better improve the treatment that is available for them, and obviously making sure that they have a good recovery plan going back in the community. The last but not the least pillar is the enforcement and justice piece, which focuses more on the diversion control, the illicit drugs market, and some of the social harm that comes with such as mischiefs or breaking in and selling drugs in the street, things like that. So we need to all focus on all of those pillars to make sure that we have a comprehensive plan for the community. It will take some time, but we are confident that with this approach we should be able to address some of the harms and social and health related harm that are happening.